right now.
Wolf, thank you so much. Great to see all of you on this Monday afternoon. I'm Brooke Baldwin. Less than a week after Liberian Ebola patient Thomas Eric Duncan died inside that Dallas hospital, one of the nurses who treated him is infected with this deadly virus. Here's what we can tell you. This nurse works at Texas Health Presbyterian. Her case is the first known transmission in the U.S. Hospital officials say she had a number of contacts with Duncan and that she followed all the proper protocols. The CDC, however, is not so certain. It believes there was some kind of breach, although it cannot pinpoint that. That was the phraseology from that news conference yesterday. A source with direct knowledge of the case tells CNN that CDC detectives talked to the nurse several times and found inconsistencies about the kinds of protective gear she wore, how she put this gear on, how she removed it. But let me share this with you. Just this morning, CDC Director Tom Frieden clarified his comments about this so-called protocol breach that a number of people were saying was absolutely blaming the nurses who are treating these Ebola patients. Here he was.
What we need to do is all take responsibility for improving the safety of those on the front lines. I feel awful that a healthcare worker became infected in the care of an Ebola patient. She was there trying to help the first patient survive, and now she has become infected. All of us have to work together to do whatever is possible to reduce the risk that any other healthcare worker becomes infected.
We'll talk to a nurse live here in just a couple of minutes because their perspective is so important. They're the ones who are helping some of these patients, and they have definitely responded vehemently to what Tom Frieden said yesterday. Also coming out of the CDC today, a bit of good news. Before Eric Duncan was hospitalized, he might have had contact with nearly 50 people. Here's what we know now. That those people, not a single one, is showing Ebola symptoms. So that is some great news. Let me bring in our CNN senior medical correspondent, Elizabeth Cohen, who's following all of this for us from Dallas. But let's get back to the Dr. Frieden comments. I mean, what was that today? Would you say that's a clarification, cleaning up what he said yesterday? Because that ticked a lot of people off.
It certainly did. I think that it was perceived as somehow blaming the nurse, when in fact the nurse is the hero here. I mean, she and other healthcare workers are so brave to take care of Ebola patients, and they shouldn't be blamed for any breach in protocol. It's a systems issue. It's not an individual issue. So the question has to be asked, are the CDC guidelines clear enough? Have they been conveyed to hospitals in the right way? And are hospitals instructing their healthcare workers how to do these processes, and are they giving them the right supervision? I have to say that something that Dr. Frieden said was a little bit disturbing. He said that, you know, they're now telling this hospital where I'm at right now to appoint a supervisor whose job it is to supervise the safety of these workers. And I got to tell you, Brooke, I've been here for weeks. I assumed that had already been done. I mean, it sounds like they didn't have anyone
not so much
specifically doing that. Right, exactly. So it's disturbing that it sounds like there wasn't someone who was appointed to do that. You know, another aspect of this is that other hospitals in Africa and hospitals here for other diseases, have a buddy system. Buddy systems are a proven way of preventing infection. When you go in, when you put on that gear, your buddy watches you. When you do the procedure with the infectious patient, your buddy is right there coaching you through it, making sure that you're not doing anything wrong. Your buddy watches you as you take the gear off. And your buddy isn't just a layperson, your buddy's another healthcare worker. And, you know, we don't know that they were doing that here.
So there are assumptions, and then there are realities, and now there are fixes. And I know that the CDC is telling these hospitals, think Ebola. What does that mean, Elizabeth?
What that means is that when someone comes in with symptoms of Ebola, which include a fever, abdominal pain, that, you know, ordinarily when you hear hoofbeats, you think horses, you don't think zebras, right? But they're saying, you know what, maybe you should think about zebras. You need to ask, has this patient had a travel history to West Africa? Here at the hospital, when they did that, when Thomas Eric Duncan came in initially back in September, but then somehow that information got lost and they kind of forgot somehow that he had that travel history. So they're saying, think about Ebola when a patient comes in with this set of symptoms.
Elizabeth Cohen in Dallas for us for weeks. Thank you so much for your reporting. And then there's the other, so many layers of the story, right? So then you have this NBC News crew. They are on mandatory lockdown here after Dr. Nancy Snyderman, she's the network's chief medical correspondent, she reportedly violated this voluntary quarantine because of the Ebola virus. Dr. Snyderman's crew was covering the Ebola crisis in Liberia when its cameraman started showing symptoms of this virus. You know his story. He's now since been flown to this Omaha, Nebraska hospital where he's currently being treated. Now, the rest of this crew, including Snyderman, who you see here in this nightly news report, you know, they all agreed to stay home, avoid contact with others, check their temperatures for 21 days. However, Snyderman reportedly chose to disregard that voluntary isolation. So for more on that, I turn to Brian Stelter, our senior media correspondent and host of Reliable Sources. Why?
I wish I knew. It is a mystery. It's a baffling thing because she and her colleagues at NBC came on television repeatedly and said they were going to self-quarantine. And by the way, they're not the only reporters who have done that. Other reporters who have been over in these affected countries in West Africa have also stayed home just to be safe. One of the reasons why you stay home is not just for your own health, it's also for people around you in your community.
Of course.
You don't want to make people nervous in your community. It's not as if people in your community are going to get sick from Ebola. It's about the nerves it creates. So the fact that she was seen out and about in her local community in New Jersey is baffling.
I mean, if anyone, just talking to Sanjay Gupta, who's been over there, if anyone knows that the realities and the ramifications of this virus, it's those people who are going to Africa to cover it.
It's a medical correspondent, and we got to give her and her team credit. I'm glad they were there doing the reporting, you know, because we need journalists there. But it's strange that she hasn't explained what happened. This apparently happened last Thursday. What I don't understand is why she hasn't made any comments. I have tried to reach out to her repeatedly.
She hasn't said anything.
She hasn't said anything. Now, NBC did put out a statement, and I can read part of it.
Okay.
They said they're not going to comment on any individual case due to privacy concerns, but then they went on to say that the team was deemed to be low risk. They've been doing all the right things by taking their temperatures. Here's the statement. It says, upon returning from Liberia, our team was deemed to be low risk and agreed to follow guidelines set by local health authorities. We fully support those guidelines and continue to expect that they will be followed. I think they were sending a message to Dr. Nancy right there. Our team are all well at normal temperatures, which they check multiple times a day, and they are also in daily contact with local health officials. I think NBC News in that statement was trying to say to Dr. Nancy and the rest of the crew, stay home. Let's not have this happen again, because clearly it's embarrassing to the network to have their health correspondent seemingly violating the self-quarantine rules.
Not good PR, not good.
Yeah, we might look back one day and say this is all an overreaction. There was no need for her to stay at home. But because of the concerns that people have right now, because of the hysteria there seems to be in some communities, it seems to be better safe than sorry.
Brian Stelter, thank you so
Thanks.
much. Also, just getting some news into CNN, moving from what we're learning about Ebola and to Ferguson, Missouri now.